Healthcare providers enlisted in the Delta State Contributory Health Commission demanding payments from enrollees for service already covered under the scheme will be made to face the wrath of the law. The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, stated this during a stakeholders' engagement with Hospital Management Board, zonal medical heads at the Asaba Specialist Hospital and the General Hospital Okwe, as part of efforts to facilitate the implementation of the Commission's updated policy. Dr. Akpoveta said challenges observed in the implementation of certain aspects of the scheme, peer review with sister health management agencies, and subsequent follow-up meetings with relevant stakeholders informed adjustments in the implementation of the scheme, hence the visits to communicate the changes to the healthcare providers for effective implementation.
Going around all the medical zones to ensure that the providers are well aware of the change in policy, implement it efficiently so that the scheme will be better for them. So we've gone around almost 8-9 medical zones. Bomadi, Ugele, Sapele, Ekpan, Wari, Eku, Agbo, Ogwashuku, Central Hospital Wari, Central Specialist Hospital Asaba with FMC. Now we're at Okwe. The next few days will be at Kwale and Ole. And so we are going around to remind providers of what is best practices in health insurance and ensure that patients are specially looked after. Now I'm happy they are getting very interested, they are getting to understand the principles, and there's a lot of improvement in the system in the last 2 weeks.
He reminded the healthcare providers that the Commission not only reviewed upwards the capitation rates paid to them, but ensured the capitation were paid upfront by the Commission through the funds made available by the state government, adding that all enrollees enlisted in the healthcare facility must receive quality care anytime they visited the facilities.
In terms of drug availability, I'm making that very clear to the hospitals now, that we have paid money for capitated patients in advance. Use that money and buy drugs and wait for the patient. And this advance payment is meant for the hospital to provide basic drugs and all that they need to treat the patient. So there is no reason why you should need to attend to the patient promptly, dispense their drug to them speedily and accurately. And the hospitals have come to understand that, and they are promised, and they're actually activating that now. Now we have our agents by the pharmacy ensuring that drugs are dispensed appropriately in this hospital.
The Director General called on enrollees to report to the Commission any health facility asking them to purchase medications for already covered conditions with evidence of receipt of payment, as the Commission would ensure a refund of their money and appropriate sanction for the health facility in line with Section 422 of its operational guidelines. Dr. Akpoveta reiterated that the state government had invested so much in the health sector, adding that the over 1 billion naira released to the Commission recently to pay for pregnant women and under 5 children had been remitted to the facilities across the state for a seamless operation of the scheme. He said to curb the influx of non-residents who invade the scheme from neighboring states, a policy was already enforced to ensure all pregnant women provide proof of attending at least 6 antenatal visits in the Commission's accredited facility in the state in order to qualify for the free delivery services, while newborn babies should be registered free of charge after 1 month to obtain a health card, saying that enrollees without health card are presumed not covered under the health scheme.
Delta is the only state in the Federation where a pregnant woman walks in and receives care without paying a kobo, from antenatal down to delivery either by cesarean section or any other means. Because of that, people are now using Delta as a pilgrimage area for delivery. They come all the way from Port Harcourt, from Lagos, from neighboring states, just trooping. And we have to stop this. It's distorting our statistics. And so, number one, you must prove that you are a resident of Delta. We are not saying you are a non-indigenous. The law says all residents, whether you are indigenous or not indigenous, you are a resident of Delta, you will take treatment. So you prove that. Bring your name, registered, showing that you live in Delta. You bring your voter's card that shows you registered in Delta. You bring your utility bill that shows that you live somewhere in Delta. Once you show evidence of living here, we'll register you free. And from there till you deliver, normal delivery, cesarean section is free. But we don't want to be treating half of the people delivering in Delta for some years now have been invaders, non-resident of Delta, and that have to stop. It's distorting our statistics as if we have more pregnant women than women in Delta. So if you are not resident in Delta, and because of screening you to register, you find that you are not a resident of Delta, you will pay. This law is made for residents of Delta State. Is that clear?
Yeah.
That's number one. Number two, if you refuse to come and register so that we can identify you as a resident of Delta, by our announcements this October, it means you don't want to take free healthcare in Delta. We've announced in radio, we have published it in newspapers, everywhere, television, that go and get a health card. During that process, we screen you and to ensure that you're a resident of Delta, whether you're under 5 or pregnant woman. If you do that, your treatment is free for under 5 and pregnant woman. But you refuse to register, and you feel that you have money to pay for yourself, and then suddenly you appear that you want to take treatment free. Where is the evidence that you're a resident of Delta? I don't know whether you're coming from the neighboring state yesterday and you want to take treatment today. It's not allowed here.
Dr. Akpoveta said under the new policy, all zonal medical centers have been advised to create a health insurance unit where enrollees of the commission could have seamless attention.
We are advising that all, especially the big hospitals, the zonal hospitals should establish health insurance units where our enrollees will be attended to specially and speedily in the hospitals. You don't need to mix up with the general population for easy identification and attention, because we have paid in advance.
The participating stakeholders, including medical directors, pharmacists, accountants, expressed appreciation and satisfaction at the meeting and promised to adhere strictly to the new policy.
It was quite educative. Yes, we got more understanding concerning the program.
It has gone a long way to clarify a lot of gray areas. You know, it's something, the new policy just started last month, so a lot of people are not yet conversant with all the policies. So this thought that the DG has undergone has really helped in clarifying. You could see the number of questions and people were asking. So I think it has been a useful sensitization tour on the part of the DG.
Very educative and informative, all we did today. We have learned a lot. Some mistakes we are making, I think is corrected.
Their engagement featured question and answer session to clarify gray areas. Eunice Emezia reporting.